الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. School Health Services, School Health Medical Services by Professor Mahmoud Hani Sulaiman. It is clear that these services are given to schools through different clinics and laboratories. Importance of school health services. It is given to children 5 to 15 years. It is a powerful means of promotion of community health due to the following reasons. First, school children constitute large number of population. They are nutritionally vulnerable. School age is the period of rapid growth and development, so this growth is better to be in a healthy manner. School age is a formative period, physically, mentally, socially, and intellectually, transforming child into adulthood. The health habits formed at this stage will be carried to adult age and next generation. Continued importance of school health services. The school is the place where child exposed to stress and strain. Hazards of group life because children come from different socio-economic and cultural backgrounds with different immunity status, different social habits, and so on. Growing children are vulnerable, so easy victims of many communicable and non-communicable diseases. At least accidents. They also suffer from many non-communicable diseases, malnutrition, dental, visual, hearing defects, congenital disease, and accidents, etc., which can be prevented by learning continue without harm. How to learn without any harm to their health. These diseases make learning difficult and may lead to changes in behavior in psychology. So it is very important period of life and very important to be healthy. Objectives of school health services: health promotion, health protection, health restoration, health education, healthy living. So all aspects of health to the school children: promotion, protection, restoration, education, and living. Health promotion to keep child physically fit and mentally alert to receive education. Health protection to protect child from various communicable and non-communicable disease. Health restoration, early diagnosis by periodical screening and prompt treatment of diseases and their follow-up. Health education to create health consciousness among children and to inoculate healthy habits and practices. Healthy living in a healthy environment of school. So health promotion, health protection, health restoration, health education, and healthy living. Components of school health. Components of school health program are health services, health for living, and health education. Health and medical services. To provide comprehensive health care as preventive, promotive, and curative service. Preventive, promotive, and curative services to the school children. First, health appraisal consists of periodical medical examination per 4 years starting from time of admission. يبقى medical examination every 4 years starting from time of admission. Initial examination must be thorough, full, and consist of history, physical examination, anthropometric examination, lab examination, and findings recorded in school health record. So health appraisal examine everything and lab almost for every important finding. Done by school medical officer assisted by school nurse. Nurse also do daily morning inspection. Daily morning inspection of child by looking for personal hygiene signs of illness as dull face, runny nose, flushed face, red and watery eyes, rashes, etc. Screening also done to detect visual defects, hearing defects. This is at the appraisal. Dental defects, any health problem detected, recorded and informed to parents by class teachers. Parents should be persuaded to get child treated. The school medical officer will manage at the clinic. So there is the clinic. Immunization. This is another clinic for school health children. Routine immunization recommended for school children are hepatitis B vaccine booster, of course, tetanus toxoid booster, of course, rubella vaccine, especially for girls. Also, this is booster because at one year he took MMR containing rubella. These are also put in the record. First aid. Emergency care will be provided by teachers to children who become injured or sick in school premises as injuries, fractures, unconsciousness, fits, vomiting, diarrhea, etc. The teachers should have received adequate training during their training program. Screening procedures includes evaluation of mental health, dental health, and effects of vision and hearing, which all hurdles in learning process. Mental health assessed by their behavior, habits, and intelligence. Behavior disorders may lead to juvenile delinquency. Habits like smoking are also taken care of. Children with low IQ referred to child guidance clinic. Dental health assessed by annual dental examinations. The common dental problems are caries of tooth caries, malocclusion, periodontal diseases of gums and supporting tissue, which are all detected and corrected. Vision. Since visual defects are serious obstacle to learning, screening by ophthalmologist to detect refractive errors, of course using Snellen's chart. Treatment done for squint, amblyopia, and eye infections. Hearing. Since hearing defect also interferes with learning, detected by audiometer and corrected. Referral services. Referral of sick children or children with visual, dental, hearing, or any other defect referred to appropriate health specialty for better treatment. Follow-up. It is necessary to ensure the child complies with the referral service. Healthful school living. Healthful school environment. Since school children spend much of their time in school only, environment must be healthy so child remain healthy physically, mentally, socially, and emotionally. School should serve as model center of good sanitation to the whole community. Elements of healthful school living are a school building, health teaching, physical education, healthy relations. A school building, playground and environmental sanitation, healthy teaching, physical education, healthy relations in the school between students, teacher, student, teacher, teacher, administration, and teacher. School building. This will include site, classroom, lighting, ventilation, sitting, environmental sanitation, healthful teaching, midday meal, physical education, pupil with pupil relation, student-teacher relation. The site of the school building. School should be central with easily approach roads and away from busy places, heavy traffic, factories, cinemas, market, and railway tracks, i.e. less noise. Wide area around elevated site with good access to air and sun. Total area of school allow at least 10 meters square for each pupil. 2/3 of the space area given to playgrounds with trees for shade. Shape of the school, blocks separated or joined at right angles with LFT shape, 1 or 2 stories with more than one stair. Younger children at lower stories. Provision of fire and safety and playground is a must. It should have an ample space, good ventilation, playground for games and physical exercise. Classrooms, rectangular shape, 6 by 8 meters. Classrooms with veranda outside, spacious inside. Pupil number maximum 30 pupils per one classroom. Blackboard at shorter sides, the 6-meter side. Distance between blackboard and first desk minimum 1.5 meters. Minimum 1.5 meters. 60 centimeters passage between rows. Minimum floor space per student is 2 meters square. Height should be minimum 3.5 meters, the height of the ceiling. Floor surface should be so smooth as to facilitate easy cleaning and washing. Classroom should have good lighting, natural, main from left side of the pupil, ventilation by windows, and window lower edge is above head of occupants. Blackboard should be such that there is no glaring. It is either black in color or green, light green. No glaring. Windows with space area at least 20% of floor at both sides, as we said, above head of occupants, as we said. Extraction fans might be put on above the windows. Lighting, sufficient natural light, preferably from sides and not from front, because it will be dazzling to eyes. If lighting is from behind, students' shadow falls on desk. Ventilation, windows should provide light evenly, sufficiently, and facilitate cross ventilation in room. Combined door and window area should be at least 40% of floor area. Here it increased because we added the door area. Bad ventilation facilitates transmission of disease. Sitting arrangements, if desk chair arrangements are improper, it will lead to development of orthopedic, postural, and myopic defects and loss of interest in writing and reading, thus interfering with learning. 3 types of desk chair arrangements. Figure is given in coming slide. 0 desk, plus desk, and minus desk. 0 desk, where vertical line from margin of desk touches edge of chair. Plus desk, where there is space between edge of chair and vertical line from desk. Minus desk is preferred. Minus desk is preferred. Minus desk is preferred where vertical line from desk falls on a chair. For health, desks should be of minus type so pupil can read and write without leaning forward and will have good backrest which will prevent postural defects, coming figure. A plus type of disc predisposes for development of myopia, contracture of chest, and spinal deformities. This is the zero disc, plus disc, and the minus disc, which is preferred. And here the pupil sits in correct position in the minus disc. The pupil sit in the minus disc in the correct position. Clean sanitation. Outside school building and in compound environment kept sanitary by providing sanitary water supply, sanitary latrines and urinals, and also by proper collection and sanitary disposal of refuse. Water supply is a must to supply clean and safe water, and supply should be continuous through taps. There must be a minimum of one drinking fountain for maximum 100 students, at least. Latrines and urinals. There must be one urinal for maximum 50 students and one latrine for maximum 100 students, separately for boys and girls. Refuse all wastes of classrooms, veranda, and other rubbish collected from dust bans and sanitary disposal. Helpful teaching. The daily teaching routine in class must be arranged in such a way that classes should be interspersed with rest pause, games, and physical exercises. The teaching classes should not be didactic, depressing, discouraging, and bring to students monotony is avoided. Midday meal. This is important for nutrition. Since school children are nutritionally vulnerable, development of malnutrition makes the child physically and mentally weak, so affecting growth and development, and interferes with learning. Thus, malnutrition is a serious obstacle to take full advantage of schooling. It is recommended to provide one nourishing meal in middle of the day. In this midday meal, efforts are directed to encourage children to adopt and enjoy good food habits and hygienic measures. Today, this program became an integral part of educational system in many countries because it improves nutritional status of children and improves educational performance. The particulars of midday meal are: it is a supplement and not a substitute for home diet. It should provide at least 1/3 of daily calorie required and about half of daily protein requirement. Cost of meal should be reasonably low. Meal should not involve complicated cooking process. Menu changed frequently to avoid monotony. Meal should be provided through their own bacteria of the schools, so fund may be formed with contribution by students, by school authorities, assistance from government, and local assistance. This is a model menu for a midday school meal. Food item and the quantity. Cereals may be 75 grams per day per child. Pulses 30 grams per day per child. Leafy vegetables 30 grams per day per child. Non-leafy vegetables 30 grams per day per child. Milk 150 milli per child per day. Oils and fats 8 grams. So it contains cereals, pulses, leafy vegetables, non-leafy vegetables, milk, oils, and fats. Physical education procedures in the school done under supervision of physical education teacher. This physical education not only helps in growth and development of the children, but also promotes a sense of teamwork and discipline. Some of them become sportsmen and women. Pupil with pupil relation and pupil with teacher relation. This must be healthy. The healthy relation between pupils and pupil helps in development of good behavior pattern and promote to retain affection throughout rest of life. Teachers can foster this relation by encouraging group discussions, by handling the conflict situations, etc. The teacher-pupil relation is also important for a healthful school living. The teacher should be a model for students in maintaining decency, discipline, punctuality, sincerity, and honesty. Health education at school. This is another important component of school health program. The objective of this program is to change the knowledge of the pupils, attitude and practice that promotes effective healthful living. Teacher is the key person to impart health education. It is directed at health needs of children. There are many areas of health education. These are the most important sites for health education: personal hygiene, prevention of disease, e.g. immunization, first aid, safety education, mental health, nutrition education, environment sanitation, health problems confronting adults, family life education, hazards of alcohol, tobacco, narcotics, and other drugs. The main areas for health education at the school are personal hygiene, prevention of disease, first aid, safety education, mental health, nutritional education, environment sanitation, health problems confronting adults, family life education, hazards of alcohol, tobacco, narcotics, and other drugs. Health education standards for school health educators. First, demonstrate the knowledge and skills of health literate educators. 2. Assess needs to determine priorities for school health education. 3. Plan effective comprehensive school education curricula and programs. Then implement health education instruction. Then assess student learning. Then plan and coordinate school health education program. Then serve as a resource person in health education. Then communicate and advocate for health and school health education. وفي النهاية أقول الحمد لله رب العالمين و thank you for your good listening.